Do you frequently feel like your heart aches sometimes? Not in a physical way, but deep inside, like a heavy cloud follows you every day. Maybe you're not crying all the time, but joy feels far away. That's what persistent depressive disorder, also called dysthymia, can feel like. It's not as intense as major depression, but it lasts much longer, usually 2 years or more in adults, 1 year in kids and teens. Imagine wearing wet clothes every day. It's uncomfortable, not life-threatening at first, but over time, it drains your energy and joy. That's dysthymia, an ongoing low mood that becomes your normal. You might think, this is just how I am, but it's actually a real condition that can improve with care. Think of your brain like a garden. For it to grow happy thoughts, it needs the right mix of sunlight, positive experiences, water, emotional support, and good soil, brain chemistry. If any of these are missing, the garden struggles. Dysthymia often comes from a mix of things. Maybe your family has a history of depression, like inheriting a garden with weak soil. Or maybe stressful life events, like bullying, losing a loved one, or constant money problems, dry out the garden over time. Trauma in childhood, like emotional neglect, can also plant seeds for long-term sadness. It's rarely one single cause. It's usually genes, brain chemicals, like serotonin, which helps you feel calm and happy, and life events working together. So asking, why me, is natural, but the real answer is often, it's not your fault. It's a mix of biology and life. What does dysthymia actually feel like day to day? Let's play a quick this or that game. Do you often feel more tired than others even after sleeping? Yes, that's a clue. Do you struggle to enjoy things you used to love, like hanging out with friends, watching movies, or eating your favorite food? Another clue. What about low self-esteem? If you often think I'm not good enough, that fits. Other signs, trouble focusing, like trying to read but your mind wanders. Eating too much or too little, feeling hopeless, like nothing will ever get better, or being too hard on yourself. A student might keep getting average grades not because they're lazy, but because they lack energy and focus. A worker might stay in a bad job because they don't believe they deserve better. The key sign, these feelings last for years, not just a few sad days. It's like living in a gray filter over your life. How is dysthymia diagnosed and treated? Imagine going to the doctor for a constant cough. They won't just say, oh, you're fine. They'll ask how long it's lasted, how bad it is, and do tests. Same with dysthymia. A mental health professional will talk with you, no lab test, but deep conversation. They'll ask about your mood, sleep, energy, and thoughts over the past 2 years. To be diagnosed, you must feel down most days, plus have at least 2 other symptoms like poor appetite, low energy, or low self-worth. Now the good news, treatment works. Therapy, especially cognitive behavioral therapy, is like a personal trainer for your brain. It helps you spot negative thoughts, I'll fail, and replace them with kinder ones, I can try and learn. Medications like SSRIs, for example sertraline, can help balance brain chemicals. Think of them as fertilizer for your brain garden. Often, combining therapy and meds works best. Treatment isn't a quick fix, but many people start feeling better in 6 to 8 weeks. And yes, improvement is possible. Can dysthymia be prevented? You can't 100% prevent it, especially if genes or trauma are involved, but you can build strong mental health armor. Imagine training for a marathon. You don't wait for the race to start running. Same with mental health. Regular exercise, even walking 20 minutes a day, boosts mood chemicals. Eating balanced meals and sleeping well are like charging your phone daily. Also, talking about feelings with a trusted friend or counselor stops small sadness from growing into big pain. For kids, a loving, supportive family can make a huge difference. If you notice early warning signs, like a teen becoming withdrawn or a friend always putting themselves down, encourage kind support early. Prevention isn't about never feeling sad, but about building resilience, like wearing a raincoat before the storm hits. Science is always learning more. One exciting advance researchers are exploring how inflammation in the body may affect the brain and mood, meaning future treatments could target inflammation. Also, digital tools like mood tracking apps help people notice patterns in their emotions, giving clearer information to doctors. New therapy formats like online CBT programs make help more accessible. And studies show lifestyle changes like regular sunlight meditation and social connection have real impact on brain health. Some scientists are even testing personalized medicine using genetic tests to find which antidepressant works best for you. It's not sci-fi, it's happening now. All this means better, faster, and more personal care in the future for people with dysthymia